Hello, everyone. Thank you for getting started and joining us here. We'll be getting started shortly, so make sure to grab that last minute water or bathroom break. We're just going to give everybody a few more minutes to join in, and we'll be back in a moment. Alrighty, good afternoon, everyone. My name is Kyle Stupai. I'm a physical therapist and clinical director here at Spear Physical and Occupational Therapy up in Westchester. We'd like to welcome back, pun intended, those of you who have attended one of our other webinars, as well as those who are here joining us for the first time. Thank you for being with here this afternoon, and we're looking forward to having a fun time with you guys over the next hour or so. For those of you who don't know Spear, we've been around the New York City area for over 20 years treating patients. We have 20 locations located all over the New York City area, including Westchester, where I am here. Since the pandemic started, in addition to our in-office visits, we also have Spear Live, which is an opportunity for you to receive physical or occupational therapy from the comfort of your own home via the computer. Within the clinics themselves, just a little background on this, we are going above and beyond CDC guidelines, taking measures to ensure that everyone is safe and our environments are clean. Please visit our website at spearcenter.com for more details in regards to that. So in our little webinar series we've been doing here since the COVID-19 pandemic, one of the things that we've come to find from a lot of our patients is people are sitting at home in chairs that may not be as good as the ones you have in the office, and people are running a lot more because gyms are closed. So as a result, we've seen an influx in patients who have low back pain, as well as some general questions about exercise with low back pain. So our team of clinicians is here today to get together and give you some more information on low backs and injuries, and more importantly, answer your questions that you guys have in regards to this. So we've created today's talk specifically for you, and we're coming live from our own homes and offices. Hopefully we don't have any tech issues, but please bear with us if we do have any of those going on here today. So as a part of our session today with the low back pain, we're going to refresh some anatomy, talk about the back a little bit, but the major portion today is answering questions from you guys from the field. We look forward to following along, and hopefully you guys participate. It won't be like other Zoom meetings. This will be interactive and fun, so we're looking forward to it. Please note that if you are experiencing any pain while performing any of the exercises that we're demonstrating today, to stop, reach out to us directly, and we'll be here to support you. Throughout the webinar, we want to hear from you guys. Please submit any questions that you have as it pertains to back pain or any of the topics that you hear from us today. If you're joining us via Zoom, the way to do that is in the Q&A feature at the bottom of the screen. So if you hover down there, you'll see the little Q&A. And if you're joining us on YouTube, we're also monitoring these comments in the section. So please feel free to leave any comments down there as well. All right, so let's pull up a little slide here with our goals for today. So today's topics, we're going to talk about what is the low back, what makes it up, and how does it function. We'll go over some common low back injuries that we're seeing in our clinics, not only today, but before COVID as well. And your chance to ask us anything. This is largely about what our audience wants, and we're here to answer any questions that you all have. All right, so now let's introduce the team that we have here today. So first here we have Chris Cottrell. Chris is an assistant director and physical therapist at our Brooklyn Heights location.
Hi everyone, thanks for joining us.
All right, next up we have George Padin, who is a therapist at our Chelsea location downtown.
Hey everyone.
We also have Sarah Shoemaker. She is at our 95 Chambers Street location as well.
Hey guys, thanks for coming back.
All right, and of course we have me. I'm located in our Westchester Pleasantville location. So I'm going to step out for a second. George is going to come in and talk a little bit about some anatomy of the low back.
All right, thank you, Kyle. So like Kyle said, we're going to talk a little bit about the anatomy and functionality of the low back. I know we touched on this a little bit last time, but there's some important concepts that I want you guys to be aware of. So like we said last time, when you think of the spine, it seems like there's a lot going on at first glance. But once you understand the basic properties of how the spine functions, the treatment becomes much more easy to follow through with. So our spines are comprised of these 24 what we call vertebrae. They're stacked on top of each other, and they all have independent motion. Think of like your ball and socket joint of your shoulder. They do the same thing, right? They slide, they glide, they could shift, they could rotate. This gives us the ability to move and do the things that we could do in daily life. Now, in between those joints, we have a disc, right, that kind of helps us support some of the load that gets transferred through the spine. We have ligaments that surround those two joints that help, keep the motion in check. There's some nerves that exit. There's arteries and veins nearby as well. So there's a lot of tissues that can exit the spine and enter the spine. But the great thing is that our spines are meant to move, and we have independent motion at every one of those 24 levels, which is pretty cool. Now, we know our spines are mobile, but we also know that our spines are strong. So when we talk about spine strength and spine resiliency, I think it's important that we bring this slide up. You guys might recognize this man from last time. Yep, Shaquille O'Neal back in action. So the reason why we bring up Shaq is that he weighs about 324 pounds. Good amount of weight. The average spine is strong enough to handle a force from Shaquille O'Neal without crumbling, which is amazing, right? Our spines could actually handle 2.5 times the weight of Shaquille O'Neal, that force coming at us without our spines breaking, right? This is for the average spine. But the whole message is that our spines are strong enough to handle really great and strong loads. Now we could say goodbye to Shaq for now. Appreciate it, Shaq. Where our spines are a little more vulnerable is when it comes to this idea of impulse, and it's a gravitational principle. Essentially what the principle is that the force increases over a longer period of time. So for sitting, for example, as we're sitting for longer periods of time, more force gets put on the joints and structures that we talked about in the beginning, and what happens is we lose the mechanical advantage to handle those forces. So what we're going to talk about now, and Sarah's going to help me here, is learn how we could activate our core to try to support those positions. Sarah, what is even our core?
Thanks, George. Yeah, so like you said, we need to keep everything supported, and all those nerves and discs and ligaments that keep the spine together, we now have to give an added muscular stability to that. So when you think the core, a lot of people just think your abdominals in the front of your trunk, but that's not right. If you think about a cylinder, that's what makes up the core. You have the top, the bottom, the front, the sides, and the back, like a water bottle or a soda can. The front is your abdominals. The side muscles are your obliques. You have your back extensors in the back. Then you have your diaphragm at the top, which we use to breathe. And then our pelvic floor makes up the floor. Our pelvic floor supports all of our internal organs, as well as controls our bowel bladder and sexual functions. These muscles all have to work together in order to support that spine and prevent any overuse or straining any of those other structures George told us about. In order for these muscles to work correctly, we have to have good posture. And what that means is our head needs to rest properly on our shoulders, and our rib cage must properly sit on our hips and pelvis. So if you kind of imagine all of those on top of each other, I'll stand so you can kind of see a little better. We don't want our head here, our hips here, anything crazy. So if you just tilt a little bit and then tuck your chin nice and back, you'll have that good posture and everything is perfectly supported and our spine is in our neutral position. Now that we kind of understand that, the anatomy of our spine, let's kind of dive into some diagnoses real quick. We're going to bring up a quick slide that kind of shows these different basic breakdowns of the diagnoses. Here are 4 simple buckets that patients can fall into. There are obviously a ton more diagnoses out there, but we just wanted to touch base on some of the most common ones that we see in the clinic. Now, just because you think that you fall into one of these buckets doesn't mean that you don't have something else underlying going on. Even though your diagnosis can also seem very black and white, there sometimes can be something a bit more you're dealing with, or you can fall into a few other buckets and not just strictly have one diagnosis or one symptom and impairment. It's all about kind of prioritizing the treatment that we do to be most effective and help the patient that we have at hand. All right, so let's go over each of these ones together. I'm going to have George come on back in, and we're going to break these down a bit for you.
Awesome.
All right, George.
Thank you. So yeah, let's start from the top down. So the first one on there was lumbar radiculopathy. radiculopathy, and that's kind of an umbrella term. A lot of times you kind of have sciatica that can fall into that category, bulge disc, nerve tension. So all those things kind of fall into lumbar radiculopathy. And what that essentially is just a inflammatory process that's occurring probably near the nerves that exit the spine. And so what happens is that usually you'll get some type of radiating pain, usually down into the leg, maybe behind the butt, maybe in front of the leg, sometimes in the foot, sometimes some numbness and tingling that can occur as well with that, and maybe some burning pain. It's not a fun condition, and I know it affects a lot of people. And usually the activities that are mostly impacted are sitting and bending forward. So to try to offload those positions, Sarah, would you mind helping me going over a prone press up?
Yeah, sure.
Awesome. So this exercise is nice because it helps us kind of get us out of these crunch slump positions and extend and straighten out our spine. So I'm gonna have Sarah go on her stomach for me. Appreciate it. And one, just being on our stomach is just a nice way to help offload some of that pressure that's being put on those nervous structures in our spine. Now, what we're going to start to do slowly, Sarah, is I want you to think about trying to extend your back off the table there, but try to start from rolling from your chest and upper back first, right? You shouldn't feel like you have to hinge right away at the low back. So let's see what you got there. There you go. And then come back down. Now, you really want to use your arms to kind of generate that force. A lot of people tend to really use their back and have their back be the prime mover in this. Your back's just going along for the ride, right? So Sarah's doing a good job of letting her arms control the motion. How are those feeling there so far, Sarah?
Pretty good.
Awesome. And what you might see with this is you might have some back tension. You feeling that in your back a little bit there?
Yeah, but where should we feel it in our back?
So if you're going to feel it in your back, I want you guys to generate tension in the upper part of your back. So maybe think about squeezing your shoulder blades together a bit more and then generating your push. Nice. That just might help you concentrate a little bit more on the upper back than the lower back here. And after you do, say, about 2 rounds of 10, 3 rounds of 10 of these, you should hopefully feel a little less of that radiating pain afterwards. All right. Thank you there, Sarah. We're going to go into talk about lumbar stenosis now. So it's a similar condition when we think about stenosis versus radiculopathy, but what happens is in stenosis, there's usually a narrowing of the kind of spinal structures where a lot of these nerves exit. So in a similar fashion, compression gets put on these nerves and you're going to have some similar symptoms. Now, the presentation that's different here is that a lot of these symptoms will occur in upright activities. Standing, maybe walking, activities where that force the spine in more extended positions that may not give the nerve as much room to move through, which is okay. We want to just offset these activities by things that kind of open up those spinal columns and spinal canals. So Sarah, if you could help me out again, we're actually going to go on our back this time, if that's okay.
Yeah.
Appreciate it. Yeah, especially if you're feeling a lot of symptoms with this condition. Nice way to kind of slowly knee towards your chest. So Sarah, I'm going to have you hug, doesn't matter which knee, and try to, really use your arms to kind of bring that hip towards your chest, hold it there for a few seconds, take a deep breath or two, and really try to let your body relax in that position. Now, what we should notice over time is that we should feel less of that radiating pain into the leg. Now, you still might feel a stretch maybe in the back of the hip or maybe a little bit into the back. Can we feel that through there, Sarah? Mm-hmm. Awesome. And then, after a few seconds, you could bring that leg back down. And as you get better at this, you could even bring both legs up at the same time too, if you want. There we go. Maybe, be careful if you just had a big meal and stomach's feeling a little full, just be mindful of that. But if not, then you're good to go for 2 legs. Awesome. All right. So that's the quick one there for radiculopathy and stenosis. Sarah, do you have anything for me there?
Yeah, so we're going to now talk about some postural overuse, which I'm sure all of us New Yorkers sitting at home are now feeling a lot of this. So a basic definition is some sort of joint dysfunction or a sprain in your lower neck, upper back, low back, caused by some increased load on those discs of your spine that George, you covered before. So it can turn into an increase in excessive or a severe decrease in the curvature of our spine. A lot of people have that forward head posture, which then changes the curvature all the way down our back, rounded shoulders, kind of pulling everything in, and then usually a slouched posture in a chair All right. We'll have pain typically with staying in these positions for a long time. You can even have difficulty breathing because now our diaphragm that makes the top of our core is not working in its proper position. So what I'm going to have you, George, do is we're going to go over bracing. All right. So we could do it sitting or laying down. Which one would you feel?
Let's go lying down. I think I've been sitting too much today.
Too much today. You're in the office, huh?
In the office. All right.
All right. So I'm going to have George, you just lay there, knees bent. Good. If you could put your hands right where they are, right above your belt line, you should feel like your front of your hip bones. Do you feel those? Good. So I want you to slide a little more medially. And so it shouldn't feel bony anymore. You should feel a little bit of a muscle there.
Not a big muscle, but something's there.
Something. You didn't just eat lunch, did you? Since you brought it up before. All right. So we need to build this strong foundation before we get all this mobility going. So this muscle we're trying to activate is your transverse abdominis.
Gotcha.
Don't need to know the name of that. But we need this to go before everything else really activates. So all you're going to do is those two fingers, when we get into the engagement, you should feel something move under your hands. All right. All I want you to do is think about pulling that belly button towards your spine and your back kind of flattening onto the floor. Good. You made a nice little gentle motion. Did you feel it?
Felt it. Yep. I think I got it.
Perfect. All right. Now I want you to just relax. Good. All right. I want to do the same thing again. We're going to hold for about 5 seconds.
Gotcha.
All right. So pull that belly button in. Good. Back nice and flat. And relax.
Sam, what if
All
I
right.
feel a little lightheaded?
You're a little lightheaded. Are you breathing? So just because you're holding in.
All right. I'll maybe make sure to do that next.
Yeah. Just because you're sucking in doesn't mean the rest of your core can't work. All right. That's our main goal, getting all of this stuff to be effective together.
Gotcha.
All right. If this gets easy, you can then add a little march. So that starts adding the mobility to the stabilization. Sit one knee up at a time. Good.
Gotcha.
Perfect.
Yeah. Can feel the core. Feels good.
Yeah. Good. Are you breathing this time?
I'm breathing. Yeah.
Good. All right. Good. You can either stay on the floor for this next one or take a rest.
Okay. I can stay on the floor. That's fine.
All right. The last diagnosis we're going to cover quickly is the diagnosis of instability. It's a very big umbrella term. There's functional instability, mechanical instability, but the general idea behind it is some sort of laxity in the vertebral column, a loss of the segmental stiffness that George covered. It could also be a decrease in our neuromuscular or muscular activation control of the lumbar spine during movements. Some sort of presentation, they're very broad, can be pain in your low back with sitting, lifting, bending, transitioning to standing. If you're feeling some spasmy, feeling achy, and staying in one position for too long and then transitioning. So a good way that we try to build this is building off that bracing that we just covered. We'll go over a bird dog, all right? Because we want that stability back in the spine while we do other mobilizations. So
why is it called a bird dog?
Because you look like a bird and a dog.
Wow, that's a lot to digest.
Right. We'll see what you look like though. Maybe we can rename it.
Sounds good.
All right, on your hands and knees. And good, we want that back to stay nice and flat. If it's too curved in either direction, George, if you can go through like an exaggerated cat-cow for me. Yeah. Good, so we don't want to look like that and we don't want to round up too high. Good, so try and find that middle point for us. Good.
I got it.
I'm gonna have you scoot a little closer to the computer.
Gotcha.
Your head's getting cut off.
There we go.
And yeah, and guys, if you are not in gallery view, switch to that so you can see George also demonstrating side by side with me. All right, cool. All right, George, you all right there?
Yep, still good.
Okay, so what we're gonna do is you're gonna take your right leg and your left arm. Even if you do it opposite, it just needs to be the opposite sides. You're gonna lift both to try and be parallel with your back,
Okay.
right? The biggest thing is you also try and brace as you lift so we don't get any of that crazy curvature.
Gotcha.
Good. If you start to feel yourself lose your core stability and your back start to arch, don't lift your leg as high.
Gotcha.
All right. Our ultimate goal is to be parallel, but we got to take some baby steps to get there.
Makes sense.
Good. All right. Perfect. And like George is doing, we can do a set just using the same side and then switch. Or if you're daring, you can do one side, come back down, switch sides. Kind of really challenge your stability. Good. How do they feel?
Good. Feels like a good core workout.
All right, perfect.
Awesome. Yeah, that was great. Thank you, Sarah.
Perfect. All right, so enough of us talking and making fun of each other. Now it's your turn to start asking us some questions.
All right, everybody. So please continue to ask us some questions via the Q&A section at the bottom. We've already gotten quite a few, so thank you all who have sent those guys in. So George and Sarah, quick one real fast. How many sets and reps for these exercises should we be doing, or how long should we be holding the stretches for?
Yeah, that's a great question. So for the exercises that you're not stretching, so like the prone press ups, the bird dogs, those you could kind of rep them out like 2 rounds of 10, 3 rounds of 10. Some of the stretches, so the knee to chest, that could be more of a 20-second to 30-second hold, 3 rounds. And the bracing, it's kind of up to you. The bracing could be anywhere from 5-second holds to 10-second holds to 15-second holds. You just have to find where that right challenge is for you, essentially.
Awesome, thank you. And for those of you who still can't see all of us when we're talking, if you go to the top right corner where it says speaker view, change it to gallery view, and you'll be able to see all of us in our demonstrations and us who are on the panel here. All right, so a couple more questions we've been getting from everybody here. A lot of questions about sleep. What are the best sleep positions for people to be in? Or if you have discomfort in a certain position, what should you do?
Yeah, so it really doesn't matter where you sleep or what position you sleep in. We have ways to get you more comfortable because you've probably been sleeping that way for years. So we're not going to try to switch things right now. The biggest one that's probably going to be the most painful with back pain is laying on your stomach. So we'll go over right now different positions and how to kind of situate yourself in laying on your back and your side. All right. George, would you mind commentating while I move?
Yeah, definitely. So Sarah, I want to start on your side first.
Okay. I have pillows, so.
Awesome. So yeah, if you're going on your side, usually a comfortable position is just trying to get on your side, and then having a pillow usually between the knees. You want your knees slightly bent to start. Awesome, Sarah. Sarah does a great job there. Yeah, and your knees just kind of come up a little bit, and usually that will do the trick. You might just have one side that's more comfortable than the other, and a lot of times that happens with back pain, so you may just have to experiment back and forth. Now, we just want to prevent that, right? So that's the goal of having that pillow there, right? You don't want to get too turny in your hips while you're sleeping. Now, if we're going to go on our back, sorry, let's actually go on our back. Now, sometimes just keeping the knees fully straight with someone who has really bad back pain could be uncomfortable. So you could do, Sarah, is actually put that pillow right under your knees, and that might help offload a little bit of pressure, on the back there. Very good. And Sarah does a great job of just using one pillow. Sometimes we tend to use 2 or 3 pillows on our neck, which could kind of actually pull lower down into our spine. So really try to be mindful of maybe using one pillow or a pillow and a half. You don't want to get too slouched in that upper part of your neck there, because that could cause some discomfort too. Awesome. Thanks for modeling that, Sarah.
Yeah. Could take a nap. Been a day.
All right, so another common question we've been getting from the audience here is people who have fusions. We got quite a few people who talk a little bit about that in their questions. What sorts of exercises can they do or can't they do? Obviously, everybody's a little bit specific and depends on the level, but generally speaking, any information on fusions?
Yeah, so I mean, with fusions, right, you first want to, it depends what stage you are after surgery. You want to make sure you're getting cleared by your doctor and the actual surgeon who did your surgery, because they saw inside of your back. So it's good to have their clearance on certain activities. Typically right after a fusion, there's usually some type of restriction on any twisting or any increase in bending. But once you get past that stage, usually a few months out, it's pretty much do things that you can tolerate, right? And you just got to make sure you just don't jump into anything new too soon, right? If you weren't running 3 months before your fusion, you probably shouldn't go back to running right after. You may have to just build up your leg strength a bit more, build up your core strength, and then slowly transition. So if you're going and thinking about a new activity, take it slow, try to break down that activity, go through the steps of that activity, and then build yourself up. Obviously, always consulting with your surgeon as well.
All right, thanks, George. Another one we're getting, this is a popular one. A lot of people working from home these days using dining room chairs or couches to sit on. What are your opinions on standing versus sitting, either at desks or intermittently or changing, or what stretches can we do in between to help out with that?
Yeah. So when it comes to the sitting desk versus standing desk debacle and debate, no one is better than the other. If you can do a mix of both, it's great. I don't want you standing for 6 hours just because your back hurts sitting, and vice versa. So if you set a timer, if you're sitting at your dining room table, set a timer every hour or so and either switch positions or just get up and go for a walk. With the chair scenario, I would not suggest working from home from the couch, because you kind of just sink into those cushions and you literally turn into a couch potato. Which is fine on the weekends when you're hanging out, but we don't want any of that slouch, those rounded shoulders, slouch posturing, because then you'll get all of those overuse or the postural changes. If you do have a nice office chair, the less is more. All the gadgets and doodads that are added to chairs can sometimes exaggerate the spinal positioning and kind of cause more pain than we already are into. So you can always add a little towel roll or something under your feet and under your arms, just to make sure you're in a nice 90-90 position.
Awesome. Very similar question. What about supports for chairs at home? Any kind of like lumbar supports or things like that?
Yeah, so supports, I mean, they don't have to be anything too fancy. We've seen a lot of things work. So anything from a rolled up sweatshirt to a rolled up long sleeve t-shirt to a rolled up just kind of wash towel, just kind of right. You want to make sure you kind of get it in the almost crease of that lower part of your back.
Yeah.
Make sure your hips are all the way back as well. A lot of times people will have the support and then their hips slouch forward, and that's really doing you not a lot of good there. So really try to make sure you're positioned properly there. And like Sarah said too, making sure your feet are fully flat on the ground. A lot of people don't put weight through their feet, so making sure maybe you need a book or two to make sure that foot is fully flat. Maybe you have to adjust your chair, so think about those things as well.
Awesome. Thank you, George. All right, next on the list here, looking down. Every therapist gets this question at some point throughout the week. Ice or heat? Go.
It depends. So general speaking, use ice in a very acute situation. You just rolled your ankle, you had a bad back spasm, say. If things are still very, very inflamed, let's ice that. It's a natural anti-inflammatory, so does the trick just like pain medication could. All right. And then if we're in more of those chronic phases, typically after a few weeks into months, you're still getting some stiffness and achiness, you can put some heat on it, 10, 15 minutes, kind of loosen things up, make you feel good, and then try to do some sort of activity, movement, exercise to kind of get those muscles moving the way we want them to, all right? Don't just rely on a hot pack when your back hurts, because you're gonna have to use a hot pack every day.
Excellent. All right, thank you guys for, we're getting a lot of questions right now, so thank you guys, keep them coming here. A couple of people have mentioned pain when they first wake up in the morning. Is there anything they can do before they go to bed or when they first wake up to help reduce that or eliminate that?
Yeah, definitely. There's definitely a few things you could do just, when you wake up in the morning, a nice way to kind of, prime your spine for the rest of the day. So, I'll just kind of go quickly on the floor here. Just some things that kind of worked well for myself and some of the patients I've worked with. Starting simple, making sure your hands are on the bed. Very simple, knees going side to side.
Perfect.
And you can kind of gauge how far you go, right? The more mobility you have, the further you could get down. You can also work on, right, like we did before, getting one knee towards your chest, and then maybe just bringing the knee across towards your opposite shoulder a little bit to try to feel a little more of a stretch through here. Holding for, like we said, 20 to 30 seconds. You can do the same thing on the other side. And then another thing you could do is just to try to get a little more segmental motion that we worked on. Just some kind of pelvic tilts. Sarah did a great job of trying to coach me through them before, right? Lightly flattening your back and then trying to create a little bit of space where the low back hits the bed. It's a nice way of kind of going through that there. Sarah, anything else that you?
No, that's what I would suggest too. And then kind of rolling like a log to get up out of bed instead of you dropping your legs or sitting straight up. Yeah, so like George just said, you want to roll as one. Your hips, ankles, knees, and shoulders all come as one, so that spine isn't being rotated or twisted anyway. That's going to be uncomfortable.
Excellent. All right, thanks guys. Getting a couple of questions about exercising. So a couple of people have mentioned Pilates, yoga, and even like weightlifting with weights. What do you guys recommend for people with back pain? What are some should or shouldn't do things?
All right. The biggest thing is going to be symptom dependent. If you have pain with lifting, I wouldn't jump straight to weightlifting. I generally tell my patients to try to start with Pilates because they go into a lot of the core stability exercises, like we kind of went over before jumping to yoga, because yoga, you already need that stability and be able to hold those prolonged positions before you start adding some of those other movements. All are fine to do as long as you have confidence in doing them and don't feel pain with doing any of them.
George, anything to add?
Yeah, I mean, that was great there. All are fine, right? You want to just, slowly expose your body into it and kind of just slowly get back into it, especially if you haven't done that activity for a certain period of time. Yeah, just be smart and try to break down the activity and take it at your own pace. That's pretty much it.
Cool. Another question we're getting a few about sciatica. Can you guys explain what sciatica actually is and some common treatments people can do for it on their own?
Yeah, so sciatica kind of falls into that umbrella term we talked about when we spoke about lumbar radiculopathy, right? And sciatica is essentially a generic term to say there's some type of inflammation occurring at the sciatic nerve. And the sciatic nerve is a bigger nerve, right? That kind of exits from our low back and then wraps around our hip, and it kind of travels down through our leg, right? So that's why it's very common, because it's just a very big nerve that could get irritated. So like we said before, a great thing is just once trying to do the positions that aggravate it less. Usually it's laying on your stomach, walking, standing upright, not sitting for too long, because those things typically can trigger it, is when you start pushing the sitting and not moving around as much. So it gets, spend some tummy time, try those press ups, and a lot of times that will help relieve it. But at the end of the day, if you are experiencing symptoms, you should get checked out by a medical professional.
Is there anything to add to that, or are you good?
No, the prone press ups are good. There's some nerve glides you can do, but I don't think we should go over them now before you have like a true diagnosis or really find out what's going on.
All right. Excellent. Couple of questions are pertaining to some exercises for the core. People who just maybe have some low, general discomfort. The gyms are closed, we can't use any machines. What are some general exercises that we can do at home to help our cores?
Yeah. So I'd always start with the bracing that we went over, and you can start adding more and more dynamic stuff to it. So like George did before, he did the marching. What you can also do is, so if you embrace and you march, then you can come up here, keep that back nice and flat, and march from here. And when you feel really good there, then you progress to a bird dog, planks, stuff like that. You could do sit-ups, but I want to make sure you have that transverse abdominis, that core bracing before we do any sit-ups, so we're not overusing that upper abdominals. George, what else do you usually give as a baseline?
Yeah, a lot of times too, those are all great core exercises there, Sarah. Sometimes I'll mix in some side planks as well. And a nice way to start is just kind of from your knees, right, with the shins supported on the ground. And you want your hip off the ground there.
Yeah.
And as you get stronger, you build your endurance, right? You can get to a full side plank, which is a very, very beneficial as well. And then Sarah spoke about those sit-ups. And the modified version really comes down to just focusing on getting your shoulders right off the ground. That's all it really comes down to, until you get strong enough where you can progress that as well. But yeah, any type of plank, any type of bird dog, those are all going to be great for your core there.
Awesome. And while we're on the topic a little bit, someone asked about foam rollers. Any thoughts on those?
Yeah.
Yeah, foam rollers are great, especially if are getting some tension just throughout your spine. We like to typically focus the foam rolling on the mid to upper part of your back. So if I have a foam roll
all these tricks
ready to go, right? Typically you want to start kind of mid back. I usually use the lower part of the shoulder blade as a nice while keeping the hips on the ground. You support your neck, and the key is not really arching your neck. You want to just rotate around the segment of the spine that the foam roller is on, right? So we're just looking at the ceiling, getting a little bit of that rotation. You feel a little tension, and then you come back up. Now you say you spend 3 to 5 reps at each segment, and then you try to work your way up the what we call thoracic spine there. You can also do some foam rolling kind of on the glutes, right? If the glutes are feeling sore as well, you can do some stuff where, I'm gonna angle my camera here a bit, where you cross one leg over and you're rolling back and forth on either side. Sometimes tackling the glutes can help alleviate some tension that's stemming into the low back as well.
Great. Just a reminder, anybody who has questions, please continue to submit them into the Q&A section. We appreciate all the stuff. We're trying to get to as many as we can. We apologize if we don't get to your specific, but we're trying to condense as many as we have here. A couple of questions on computer setup for home. Laptops, desktops, how we should set up the keyboards, the monitors, things like that.
So you want everything to be eye level. So a lot of times laptop screens, you have to either tilt it very far or your arms are up too high or too low. So what I suggest is if you work on a laptop and the screen isn't even enough with your eyes, I would raise it up, stack of books. You can get some of those elevated holders for your laptop. But with that, I would then suggest an external keyboard, because you want your shoulders to be at a 90-90 position to the board. You don't want anything up too high. You don't want it too low. So a lot of times you can't do that with a laptop and the keyboard attached to it. Same thing with sitting. You want your hips to be even and your feet on the floor, like George showed us before. So if you have to kind of stack some books up, shoe boxes, anything to place your feet on, so your hips are not lower than your knees.
And what you can do too is just make sure like you zoom the font larger, right? A lot of times I do this too, where I'm just like, what is that? Right? So really zoom out that font and make it easier for yourself so you actually can sit back and digest that information.
Mhm.
Great. I have a question about driving. How should we set the car seat? Should we sit up nice and tall? Should we lean kind of back? Should we find something in the middle? How do we adjust for sitting in the car, especially long road trips?
Kind of the same thing.
It's definitely it definitely depends on the person. The key that we want to just avoid, we'll kind of show you the extremes of what you shouldn't do, and then you can find the middle ground from there, right? So typically what you see like in the Fast and Furious movies, the lean back, here with the leg kicked out, that's too much of an angle. Your back's really taking on a lot of stress, and your hips, you're really not on your sit bones. You should feel, those bony bones underneath your bums. You should feel like you can actually put weight through those sit bones, and then have your chair tilted enough where you don't lose that pressure. So for some people, it's up right here. Some people can recline a little bit back, as long as you're not losing the weight through those sit bones. And just pay attention to the knee, especially for those who might have some of those sciatic or radiating symptoms. If you're hitting the pedal and you really have to stretch out that knee, that could put a lot of tension on that nerve behind the back of the leg there. So maybe have to get the seat scooted a little bit closer to minimize that knee angle a bit, if that makes sense.
A good rule of thumb too is you always want your back to be touching the surface.
Yeah.
Your backs and hips should always be touching something. So if you don't feel the surface you're sitting on, try and readjust. Add some padding or the towel roll or blanket that George showed before.
Excellent.
Great points there.
I'm going to try to condense. There's a couple different questions and ways people have been asking this, but people who have multiple things going on, whether it be a herniated disc with arthritis, with a hip replacement, with sciatica, if you have multiple things going on, are there any things that people should absolutely steer clear of before talking to a trained professional, or are there some things that are safe that are generally for people with any condition to be able to try?
Yeah, I mean, that's a great question. Typically, you want to be able to make sure in any situation that you could, slowly engage your core muscles with the bracing that Sarah showed us, and be able to, tolerate those positions and that activation, say, in sitting and standing and things like that. Outside of that, you want to make sure you're just getting, daily activities in, walking, things like that. But outside of those things, it's just tough to say where you're at in terms of what's the priority of exercises that would best fit your needs. But as long as you could lightly engage your core and still do things functionally like walking and things like that, at least you could tackle those things before seeing someone. Sarah, I don't know if you have anything else to add there.
Oh, that's great. If you're having difficulty with like loading the dishwasher or picking up your laundry basket, stuff like that, I would not push yourself into doing exercise. Stick with the walking, the core embracing, kind of the lower level stuff until you can get through your daily activities. But if you are having multiple issues or impairments happening at the same time, I would definitely try to see someone, make sure you are doing the right things.
Awesome. We got a question from our YouTube channel, which, by the way, you guys can comment on that to ask us any questions. Running as it pertains to back pain. Someone's having back pain while running. Is there anything that they can do with their running style or change, or some things they can do to help with back pain?
I always prescribe like an active warm-up. Make sure you're really engaging that core and your glutes before you go and hit the pavement or the treadmill. So you're not pulling from everywhere else or straining your back just to get some sort of stability.
Yeah, and that's a great point, Sarah, too. And a lot of times what we see now, people are running more and got back into it quickly just because, right, people can't go to the gym. Usually there's a lack of force transferability, especially when we're in this kind of stride position, right? One leg back, one leg forward. So any type of strengthening exercises that you could do that kind of mimic a running stride, lunges, kind of stability marching, things like that will be super helpful and will translate to just better force transferring and hopefully less pain generated to that back there as well.
Yeah, that and single leg stuff. because running is really you just going from one leg to the next. They're both not on the ground at the same time. So the more engagement you can get standing on one leg, the better you'll get that transfer into the actual activity.
Very similar question, but what about biking? Any things you can do to a bike to set the bike up for success and not having back pain?
Yeah. So just similar to sitting, you don't want that rounded position. So you don't want any of this. We want a nice hip hinge. So if you sit up nice and straight, you want to be in this kind of position, not this position. All right. So whether that is you have to raise your seat up, raise your handlebars, or vice versa, try and get yourself in that hip hinge position. And then your elbows nice and bent at that 90 degrees, and your legs should similarly, like sitting, be bent, and then you want to be far enough from the pedals that your leg is almost straight. All right, but it's going to take a lot of trial and error. There's no one size fits all.
And then another thing to keep in mind with biking is your bike should be set up to the point, whether it's from the seat angle or for the handlebar angle, that if you're riding your bike, you should still feel like you could use your core to hold your body up and not rely on your arms, right? So if you're overusing your arms, there's probably something setup wise that's not letting you actually engage your core and set your spine up for success.
Yeah, perfect point.
Awesome. We had one question come in, a very interesting one. What about women who are pregnant? Is there anything that they should avoid or focus on in those stages?
Yeah, lucky for you guys, I also treat pelvic floor. So I see a lot of prenatal patients with back pain. It's very symptom dependent. So you have a lot of precautions with pregnancy. You don't want to lay on your back for too long. You shouldn't lay on your side. So we do a lot of sitting exercises, but the same thing, you still have a core. It's just a little stretched out and you're a little off balance. Now that you have, your force is a little more anterior than it was pre-pregnancy. You can still do that bracing because that'll then help with any diastasis, any possibilities with straining or pulling at your abdomen. But the same thing, the bracing, you can do bird dogs when you're pregnant, clamshells on your side, get those glutes strong enough. A lot of it is tailored to your aches and pains than a strict prescription protocol that we would follow.
Awesome. And Sarah, if you could just elaborate along a little bit, how can a pelvic floor issue relate to back pain, just in general?
So I quickly mentioned it before, but our core, the top is our diaphragm and the bottom is our pelvic floor. We sit on our pelvic floor all day when we're in good posture. So if you think about kind of just rocking your pelvis back and forth as you're sitting there, George, if you wouldn't mind.
Mm-hmm.
Good. So you want to feel like, yes, you're on your sit bones, but you should also be kind of right in between. Your pubic bone is in the front, so we don't want to be all the way exaggerated, not like that. And now George, rock all the way back. Good, or that. So you want to find that nice sweet spot. Perfect. So our pelvic floor is like a hammock. We're sitting on this hammock to support us. If we don't have good posture, then the muscles are either too far up, stretched out, or they're being kind of squashed and not being utilized the way they should be. All right. So we want to make sure we have all of those supports to keep us on the pelvic floor and keeping it as efficient as you can, because not only are you going to have back pain, you can have bowel bladder issues, you can have sexual dysfunction, a whole slew of other things can happen, and more than just back pain.
Awesome. Thank you, Sarah. Cool. Everybody keep the questions coming into the Q&A here. We have about 5 or 10 more minutes. We'll try to get through as many as we can. If we don't get to all the questions, we will be sending out a little FAQ later on and kind of summarize some things up. This is also being recorded as well, and we'll be able to post this. So if anybody has any questions or wants to view back on some things, anybody who's joining late, please feel free to do so. With that, we'll give you all the information. Good question here. What does it mean when your back cracks?
Yeah, so, cracking, right, it happens at the back, it can happen at the knuckles, it can happen at any joint in our body. It's essentially a moment of gas exchange that occurs. Now, sometimes people are addicted to that sensation and tend to do it a lot. Some people don't really do it at all. It really comes down to balance. If you're at a point where you feel like you have to crack your back all the time, there's probably something else that's going on that's leading you to kind of ease out of those motions or avoid certain motions or feel like you have to alleviate certain type of stiffness or whatever you might be feeling. So it's just kind of listen to your body. If you're getting to that point where your back's just cracking all the time, or you feel like you need to crack it to loosen it up, there might be something else going on. So it might be worth checking out that kind of condition with a healthcare professional. But if a back just kind of cracks, pops once in a while, totally normal thing that happens.
We have another YouTube question that came in from the chat in there. Somebody has a desk chair who's too low for their computer screen, so they sit on a cushion to bolster them up. Should they have a back cushion? To broaden that question out a little bit more, if you don't have a chair that can adjust properly, what are some things that you can do, taking things around the house to help make your desk setup as good as possible?
Yeah, so sitting on a cushion is great as long as you still feel high enough. Plenty of pillows, roll up blankets to support yourself. Hopefully your desk chair has a back support. If it does and you don't feel like you're close enough now because you're propped up so much on the cushion, then I would add either some blankets back there, or as George did before, roll up that towel or a blanket, because like I mentioned, you really want your back against something.
Yeah, great point there, Sarah.
All right. I have a question about people having the little bike wheels at your desk chair. Have you guys seen those? What do you guys think about those? Not a bike, just like the little wheels at the bottom of the desk.
Yeah.
Yeah, I mean, I think it's great. You could totally, go for it. I wouldn't spend all day on the bike wheel, like similar to Sarah was saying when it comes to sitting versus standing. You want everything to balance out. So if you're on the bike wheel for an hour or more, that could lead to just some issues of your spine not transferring force directly because your feet aren't firmly grounded. So just think about that. If you want to spend 20 to 30 minutes, just kind of getting some movement in, that's fine. But also try to mix in some nice standard positions as well if you can.
Okay. You can also go for a walk.
And go for a walk. Yep.
Just change it up.
We have time for one or two more questions. Somebody gets them in here. Let's see. One of the things that people do is they stand to get rid of their back pain from sitting for too long. But what about people who stand and standing hurts? What can they do?
Yeah, I think, the biggest thing with standing, if standing's uncomfortable, Sarah kind of talked about making sure things are aligned, right? So when we talk about a nice standing posture, like Sarah alluded to before, you almost want to have two hands, right? One on top of your chest, one on the bottom part of your belly. And you want to make sure those two hands are kind of stacked up in the same plane. If you're catching yourself standing and you have your hands here and one hand is forward, you just have to either adjust your upper body or pull in your lower body to make sure those two things are nice and even there. And then you may just have to start exercising your core and hip muscles in more standing positions just to build up your endurance as well.
Yeah, the main thing is, in general, you want to build up and practice kind of what the activity you're doing. If you're running and you're trying to get back to running, you're not going to swim to start running. You want to kind of break down the movements that you're trying to get back to and build up each foundation as you go. So as George said, with the standing, you kind of got to break it down to figure out what you need to piece together so that's comfortable again.
Awesome. All righty. All right, so we're going to wrap it up here, but I want to give George and Sarah one last little piece, one piece of advice that you guys have for somebody who's experiencing back pain, who maybe didn't have a question, didn't think of something. What's the best piece of advice you would give to somebody walking away from this?
George, you can go first.
Yeah, your best posture is your next posture, right? So just kind of keep moving throughout the day. Sorry if I stole that from you, Sarah.
Right, I got one.
But yeah, just keep moving, don't stay stagnant, and really use those timers throughout your day to be more proactive about moving instead of reactive.
Mm-hmm. Yeah. On a similar note, motion is lotion. So keep going throughout the day. Don't continue to be couch potatoes if that's what you're doing. Kind of the more you move and prime that body, the better you'll start to feel.
Awesome. Well, thank you guys. I know everybody who sent in the question, we get some people who are very appreciative. So thank you guys for taking some time to explain that. Again, for anybody listening, if your question didn't get answered or you have something a little bit more specific towards you, we will be available to answer these questions, and we will post these later on, and we will be recording the session as well and posting it. So if you want to get a hold of us, we're going to put our contact information up here on the screen. You can see for George and Sarah how to get a hold of them. We'll leave this up for a couple seconds so people can write down the emails if they'd like to. Again, Sarah practices out of our Tribeca office and also offers pelvic floor therapy as well. And George treats out of our Chelsea 16th Street office. And there's his contact up there. So that's, if you guys want to reach out to us directly, that's the best way to do so. If you'd like to reach me with that awful hair day, please reach out to me with my email there as well. I'm located up in Westchester at our Pleasantville location, located inside Athletes Warehouse. And Chris, who's been answering all your questions in the background, anybody who had a question that was answered online from us, that was Chris Cottrell. She is the assistant director and a therapist at our Brooklyn Heights office. So please reach out to her as well. Leave it up for a couple more seconds. And if you guys have any other questions or would like to get in touch with us for any other appointments, please visit us at spearcenter.com/appointment. Thank you all so much for joining us. Please join us next week. Our topic next week will be on increasing your athletic ability and reducing your likelihood of injury in sport, dance, and everyday life. So we'll have some return to sport stuff and how to avoid injuries as we get back into the gym, hopefully once they open up. So thank you guys. We appreciate it. And we'll be back next week.
See you guys.
Thank you.